Thank you for inviting me here today to speak to you all about basal and squamous cell carcinomas of the skin, the most common forms of cancer, as you'll hear in the United States. These are my disclosures, and we'll get started right away with the facts and figures. Whenever we talk about skin cancers, we're really talking about three main kinds of skin cancer. You'll hear me reference them over and over again: basal cell cancers, squamous cell cancers, and melanomas. And why are we so focused on these? First of all, it is so very common. Skin cancer accounts for nearly half of all cancers in the United States. That is, for every cancer that is not of the skin, there's at least one skin cancer in case across the entire country. More than 3.5 million new cases in the United States, probably way more than 3.5 million, because record keeping among all the cases that are treated at dermatologist offices that are burned off, scraped off, sometimes without even a biopsy, we don't come close to having an accurate number of cases compared to the major forms of cancer, including melanoma, which are monitored more carefully. But the bottom line, no matter how you look at it, the sun is not your friend. Skin cancers are really, really common, and they can affect just about anybody. How common? Nearly 1 in 5 non-Hispanic white Americans will develop skin cancer in this country during their lifetime. That's a lot of people. In places like Florida, where I am, the southwestern United States, places like that where there is a lot of sun exposure, that rate is probably much higher than 1 in 5. So this is a really, really, really common problem. Now let's talk about what these cancers are and where they come from, what they look like. Okay, what I've got here is on the top part is a microscope slide of the normal skin, and the arrows point to the two different main epithelial, meaning superficial or surface cells of the skin. These are the squamous cells and the basal cells. And what do you know? If you have squamous cells and basal cells normally, if they go bad, they turn into basal cell cancers and squamous cell cancers. And what we see on the bottom half of the screen, the basal cell cancer is the one that's all the way on the left side. The squamous cell cancer is in the middle, and the third cancer is from another kind of cell that's in the skin. The melanocyte, when they go bad, that turns into melanoma. We'll come back to that a little bit at the very end, but mostly we're going to talk about basal and squamous cell cancers. So let's take a deeper look, but remember these first couple of pictures, and you'll see some others as we go along in this.